Hello and welcome to this webinar hosted by the American Board of Internal Medicine. I am Mac Granato, President and CEO of the Pulmonary Hypertension Association, and November is Pulmonary Hypertension Awareness Month. We're honored to have the opportunity to discuss PH with the members of the ABIM. Pulmonary hypertension is a rare condition believed to affect 1 to 3% of the population for which no cure currently exists. It is difficult to diagnose and symptoms are similar to those of common ailments. Today, I would like to introduce you to a pulmonary hypertension patient and also physicians who treat it to discuss the work of the Pulmonary Hypertension Association, or PHA, and more specifically, our focus on quality care through PH Care Centers, or PHCC, and the establishment of the PHA Patient Registry, or PHAR. Before I introduce my co-hosts, I'd like to tell you more about PHA. We began over 30 years ago and still remain a patient-focused advocacy organization headquartered in Washington, D.C. We are the largest and oldest nonprofit dedicated to the PH community, including patients, caregivers, and healthcare professionals. Our mission is to extend and improve the lives of those affected by PH, and we achieve that by focusing on 4 main activities: public awareness and advocacy, research promotion and funding, patient and caregiver education and support, and quality care through CME education and our accreditation program, PHCC, which today counts with over 35 centers across the United States. Now, I would like to introduce you to Colleen Connor, a long-term PH patient and leader in the community who also serves on the board of PHA and on the Pulmonary Disease Board of the ABIM. Dr. Delphine Young is a board-certified pediatric cardiologist at Seattle Children's and the chair of the PHA Accreditation and Registry Committee. In addition, Dr. Joel Wirth, a board-certified pulmonologist affiliated with Maine Medical Center in Portland, Maine, and former chair of PHA's Pulmonary Hypertension Care Center program, and Dr. Dan Grinnan, a board-certified pulmonologist at Virginia Commonwealth University Health in Richmond, Virginia, are 2 of the experts who developed the program standards and will tell us more about the accreditation and registry programs at PHA. But first, Colleen, can you tell us about your experience with PH and what PHA means to you?
Yeah, thanks very much, Matt. I was diagnosed at 38 years old with idiopathic pulmonary arterial hypertension. And my children were young, and I was desperate to meet other patients and learn what I could do to give myself the best opportunity of surviving. And PHA was a lifeline to me, connecting me directly to patients through support groups, and importantly, educating me about critical topics such as the available treatments, managing insurance, and so much more. My interactions with other patients has really boosted my practical knowledge and confidence to strive to thrive, even in spite of PH, and live my best life while navigating this very complicated disease. Dr. Young, can you share what it means from a physician perspective?
Yes, thank you, Colleen, for sharing your story. And I think of the stories of many other patients like you. In my world, it's the pediatric patients and their parents. And PHA is often the first resource I offer to them when they are in the initial shock phases. They reach out to other people who've been through this in their particular shoes. And they also have patient education information that starts at the beginning and helps walk them through the disease, and then becomes a partner walking them through the rest of their journey. As a physician, when I see that, it helps. It's an extension of my team to help our patients. And PHA also is an extension of our professional community and a source of support and education and helping us learn and strive and be better together. Joel, what do you think?
Thanks, Delphine and Colleen. I agree with everything you've said. I think PHA is an extension of the PH care team for clinicians, provides important community support for patients through organizing support groups, and it's a professional home for providers. PHA is really a trusted source of education for patients as well as continuing medical education for providers. It sponsors an international conference for providers and patients every other year. additionally, it has an important role as an advocate for providers and patients in Washington.
Thank you all. Earlier, I actually mentioned that one of PHA's goals is to promote quality patient care through the accreditation program, or PHCC. So, Dr. Worth, I wanted to ask you, what was the genesis of the PHCC? What were the needs at the time?
Yeah, thanks, Matt. As subspecialized PAH and PH care really has developed and grown across the country, the PHA Scientific Leadership Council noted about 12 years ago that we had very limited understanding about the availability of expert care across the country and the spectrum of PH care delivery systems in the U.S. And additionally, there were big gaps in knowledge and understanding PH care quality and patient outcomes. So beginning in 2011, the PHCC was formed by the PHA and the Scientific Leadership Council of the PHA through a series of working groups and committees, which really set out to define best practices for PH care and define optimum care delivery models, and really set out to establish an accreditation program for medical centers and practices across the country. And the fundamental goals of the PHCC were laid out at the very beginning. One was to increase patient access to PH care so that patients didn't have to travel great distances to see a provider, to foster PH-specific education for both patients and healthcare professionals, and to promote and enhance PH standards of care. And longer-term goals of the program overall were to improve PH care and outcomes, including earlier diagnosis for patients with PH and helping facilitate an eventual cure for PH. And the PHA Registry, or PHAR, as we refer to it, was really developed to measure specific quality of care metrics and PH patient outcomes in order to help reach these programmatic goals. Dan, what has PHCC meant to you professionally?
Thanks, Joel. I think I'll tell you a little bit about the journey at my healthcare system in Virginia. And the reason to share it is I think it does encapsulate what's happening across the country. Our experience is very typical, that if you hear about what it was like for our healthcare system to get accredited, expand that times 85, and you'll get an idea of what's going on across the country. Before we were an accredited center, we had a core group that was passionate about delivering care for pulmonary hypertension. But we felt that we were under-resourced, that anytime someone left to go out of town, that there wasn't enough to go around. We really struggled. We call it redundancy at a position to make sure that if someone's pulled away, someone else can help take care of people. Pulmonary hypertension, Matt, I think as you explained nicely, it's a rare condition compared to other conditions that are around. So a large healthcare system, it can go unknown to hospital leadership. And before we were accredited, I think that several in the healthcare system were unaware that we had this core group of providers that were passionate about this care. The process of accreditation really changed that. Dr. Worth, you actually came down to Richmond and helped us through that process. And it was clear from the start that the mission was to support programs, and that was incredible. And the administration is required to be part of that process, as are different healthcare arms. It's not just the pulmonary or cardiology team that's providing care to people with pulmonary hypertension. It's incorporating how you refer people for transplant or how you work with rheumatology, how the whole healthcare system comes together. And as we got accredited, we realized all these parts and pieces are there. The light was shown on things that we did well and things that we weren't doing well, things that we needed to work on to provide better care for people with pulmonary hypertension. So at the end of the accreditation process, I think we realized that it was just the beginning, that was what we learned about the accreditation process, that this is something that's going to continue indefinitely, because every 3 years we go through the cycle of getting reaccredited. And once again, we're shown what we're doing well and things that we need to work on as a program. And all across the country, this leads to improvements. And when our administration realized what we were doing and became aware. They were very supportive. And when PHA said, you need to add more support at the level of a coordinator who can help patients maneuver the healthcare system in that way, the administration listened and we built our program. And when prior authorizations with medications became overwhelming, a pharmacy technician could get added. And then more providers as the patient volume expanded. So this meant better care for people with pulmonary hypertension. And this is not our story. This is all across the country what the accreditation process has meant. Colleen, I'd love to hear from you what this process has meant to patients.
The process in these programs honestly mean everything to patients. Having survived PAH for 15 years now, I've been friends and had friendships with some people who were failing. And yet they were convinced that their physician was offering everything they could, but they were never offered therapies that I had been on, like the most powerful gold standard therapies as options, such as invasive treatments involving continuous intravenous therapies and the like. And my friends had catastrophic outcomes, and it's been devastating to me. And now to know that with PH care centers, I can direct any PH patient to them. As patients, we know and we see when a center is accredited that they're sharing best practices, that there's an elevation of capabilities, and honestly, it gives us tremendous peace of mind as a patient. Personally, I've never been more excited about patient programs than I am for the PH Care Center and the PHA Registry. I believe that the learnings and the powerful metrics are truly fulfilling PHA's mission of improving and extending the lives of patients. Dr. Worth, can you tell us what you're seeing as a result of the programs and the impact of patients?
Yeah, sure, Colleen. So we've had a lot of success, I would say, with the program so far. And I am biased, but I will say I think the program has really outperformed our expectations. The PHCC program was designed to be inclusive, and it really strived for each program applicant to successfully achieve accreditation. So that's really the goal of the program. We want to bring programs along. We want to make them part of the bigger care network that we're developing across the country. And stakeholders have really responded to this. We have high engagement with the program. PHA so far has accredited 85 programs, as mentioned earlier, over the past 9 years since we began accreditations in 2014. We're approaching 100 sites with the applications that are currently under review. And furthermore, about 95 or more percent of programs have sought reaccreditation, which is really a testament to the level of engagement in our community. Program-wide, the PHCC has really fostered thousands of hours of continuing medical education in PH for physicians and nurses. Scores of patient support groups are regularly now assisted by professional personnel for patient education. And PHCC's really helped foster career opportunities for providers and support staff, as Dan alluded to, and really career opportunities in education, program development, clinical research. And we have many new physicians and professional staff brought into the a family for sustainability of the program and succession planning, which is good as people like me age out. National standards for PH care have been developed through group consensus, and we promote these by site visits by clinical peers. And so we reach consensus and a level set understanding of what provides good care to patients. And then these accreditation criteria and assessment methods are periodically modified as new developments in our field are incorporated into the care center program. And using FAR data and classic quality improvement tools, as Dan noted, programs are asked to demonstrate performance improvement relative to specific quality metric reaccreditation. And we have multiple examples of programs improving their care quality over time using these tools, which really elevates the game for them and for everyone else across the country. So it's a It's a joint venture to improve care globally on a number of outcome metrics and interim metrics as well. And importantly, overall FAR data for the population of patients cared for within our program has shown a year-over-year reduction in annual hospitalization rates and a reduction in PH-associated mortality. So the program is working as designed. So we're very happy to see that with our FAR. Data from FAR also suggests that patients may be getting referred at earlier stages of the disease, which is very positive, although more studies really needed to be certain of that trend. There's also been leveraged in an increasing fashion to assist clinical research. Dan, could you comment more on that? I think that's a very exciting area for the PHCC clinical network as well as for FAR.
Thanks, Joel. Absolutely. And when, as you said, when the registry was initially set up, the idea was to have it go hand in hand with this accreditation process and have this pivotal role in quality improvement initiatives. But there is that other aspect that this is a registry that can be used to push the field further and as a research tool. And one of the things, going back to when the registry was first developed, that I think was so important and essential was the idea of how this data could be used and who could have access to it. A lot of registries are set up where there's a steering committee or group of people that are making all the decisions about who could have access to data and how this data can be used. But the PHA registry, I think everything that PHA does, it has the patients in mind. And the idea was that at each center, there can be people who are asking really important questions and have essential ideas to be studied. So this data, as it's going into the registry and the registry is growing, they said, any provider at a center who is participating from a FAR participating center, they can submit a proposal. And that proposal, if it's accepted through the publication and presentation committee, then that can lead to presentation, publication, and new information. And that's turned out to be incredibly motivating. There have been many young physicians in training who have been the first author of publications, sort of mentored into that role by senior authors who are helping them to get these results out and getting it published. It's been incredibly helpful as a mentoring tool, but also tons of different questions that are being answered. So at this point in time, it's led over to 35 proposals being accepted through this registry and 17 different publications to date. And that's really picked up steam over the last couple of years. And just as examples, what you can do with one of these proposals is say, okay, we have this real world registry from 85 centers. Not all those centers are participating in the FAR, but the vast majority are. And we have all this information coming in from all over the country. And that information can lead to comparisons between different groups. So you can find out, how do people that are living at a high altitude compare to people who aren't living at a high altitude? How does the Hispanic population compare with their outcomes compared to the rest of the pulmonary hypertension population? What are regional differences in outcomes among patients with pulmonary hypertension? You can also look at different diagnostic tests and tools and learn more about how those tools and tests are helping people with pulmonary hypertension. For example, quality of life data is captured, and you can learn more about the validity of those quality of life tools. So those are just a couple examples of the exciting research that's starting to come out. On top of that, there's a layer of ancillary studies, and these are studies that have funding, often from external source, such as the NIH, and they are studying things, but they'll embed within the FAR, the PHA registry. So they'll get access to some of the de-identified information from the FAR, but they'll also look at new and important concepts. Just as an example, there's an ancillary study in the FAR right now. There are 3 active ones, but one of them is looking at the role of patient movement and recording patient movement, actigraphy, and how that's going to change patient outcomes and which patients are able to move more and to really open up a new way of assessing and evaluating pulmonary hypertension. So just a couple examples about how the FAR is being used in research. There's also the idea that as the registry grows and now incorporates almost 3,000 patients, which certainly places it as a very large pulmonary hypertension registry, that's really important. So some of the industry partners and sponsors can get de-identified reports to learn more about some of the trends within the pulmonary hypertension population over time. So that's just a little bit of how the FAR Pulmonary Hypertension Association Registry is an incredibly valuable resource tool. I think it's only going to get more valuable with time.
Well, thank you, Joel and Dan. It's really exciting what we've done and what we've accomplished so far and where we're heading. So, Dr. Young, can you tell us more about the future of the program?
Thanks, Matt. I enjoyed hearing about all we've been doing, and I want to say that we are not resting. We are continuing to improve. We are updating all the standards for accreditation, and in addition, we're looking at some of the spots that we can improve in with regard to where our centers are located and making some efforts to make sure that all patients have an accredited center within a reasonable transportation distance. We're also looking at expanding the pediatric groups. I'm from a pediatric center. It's important that we have a critical mass of pediatric centers that care for patients with pulmonary hypertension as kids.
Thank you, Dr. Young. That's right. Both the accreditation and the registry programs are expanding fast at PHA. And PHA is not just for professionals who specialize in PH, but also for other healthcare professionals who want to learn more about PH to recognize the symptoms early and refer patients to expert care as soon as possible. This disease is a race against time, and the earlier the diagnosis and treatment, the better the outcomes. Professional services at PHA include PHA's International Conference and Scientific Sessions, the PH Symposium, and Online University, which contains a library of CME courses covering a very wide range of PH topics. In addition, PHA offers research grants to fellows and young investigators engaged in pulmonary hypertension research and treatment, as well as bridge funding for NIH grants. And I'd like to encourage you to learn more about PHA at phsociation.org. And now, thank you for listening and for your interest in pulmonary hypertension, and many thanks to the ABIM for hosting us. Thank you.